Hi, in today's video, let's talk about two different types of strabismus surgery. And before I do that, let's tell you how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, it's okay. You can still connect with us. Go to our website at visionforlifeworks.com. And once you're there, you can do a couple of things. You can certainly take a quiz. You can also read through success stories and read information more about what we do at our clinic. But if you're ready to take that next step, you might want to schedule a consultation by clicking on the button. All right, let's talk surgery, strabismus surgery in the two types. There are two forms. One is called a resection, where they take a piece of the muscle or tendon out, and that would maybe tighten up the alignment of the eye and help it to align better. Another form of surgery is usually called recession, where they take the muscle off of the eye and they move it into a new location. Now, many times people will ask me, and this typically comes up after 3, 4, 5, or 6 surgeries. They'll ask me, well, what is the problem? Why is the eye not being lined up or used properly by the brain? Why don't I have normal depth perception if my eye is lined up better? You know, what is the issue with why I still have these binocular vision issues? And while I use a little bit of a maybe somewhat silly example to explain to them, it really helps them to understand. In particular, we talk about whenever we have a recession where the muscle is taken off of the eye and moved into a new location. So typically it's taken off and moved in a back location farther back on the globe itself. And so what I say is, well, let's just imagine in a recession that it would be similar to taking your arm off and putting it on your back. So while no one would want to do that, and we're never suggesting that it's the exact same thing, it's just maybe a silly enough explanation that helps people to understand that just moving the muscle into a new location doesn't mean the brain would know how to do it, because you're wired for your arm to be in this location. You're not wired for your arm to be on your back. And so when your muscle of your eye is moved into a different location, it doesn't just necessarily mean that the brain knows what to do with that. It's almost like you've made a disconnection between the brain and how the muscle of the eye was working together as a unit before by moving it into a different position. So it just doesn't mean that the brain will pick up and know exactly what to do. Well, what about in a resection where a portion of the muscle or maybe a portion of the tendon was taken out? And, why is there a problem with the brain coordinating information with the eye in that particular case? Well, I tell people, okay, well, there again, let's just use this maybe somewhat silly and method of explaining it by saying, like, well, let's just take the arm off and take a portion of the arm out and then put it back. So it doesn't mean that the arm is just going to know and the brain is just going to know exactly what to do with that. So there has to be like a retraining and a re-coordinating of the information where the brain is trying to sync up information with that eye again to learn how to move it the proper way and to maintain certain alignment. Now, again, this is meant to be somewhat of maybe a silly type of explanation. So I know, sure as the world, I'll get someone who's probably a doctor, probably an eye doctor, who says, why would you ever use that explanation? Well, because it helps people to understand. That's why. So is it technical? Is it grammatically correct or surgically correct? No, but it's just an example to help someone understand why there's a misconnection with the brain and the eye once a strabismus surgery occurs. Now, in some cases, things just go off without a hitch and it's completely back to normal. But in many cases, and certainly in the patients that I see, that's not necessarily the case, which is why they're coming to me in the first place. So this is just another method of explaining it. Hopefully it helps you. Maybe it created just a silly visualization for you of the whole thing all together, and maybe it made you smile, and that's good enough too. So for more information, you can go to our website at visionforlifeworks.com. If you're ready to take a next step and you're not local, you'll want to schedule a consultation. If you are local, give us a call at 618-288-1489. If you haven't done so, Make sure that you subscribe to our channel. Also hit the like button. And if you feel like this was helpful and a helpful, silly explanation that could be beneficial to someone else, then please pass it on. Thank you.